You ever wonder how doctors make their decisions about diabetes? Well, it's not a guessing game. They have an official rule book, a blueprint that comes out every single year from the American Diabetes Association. So today, we're going to crack open the brand new 2025 version and see exactly how they diagnose and screen for diabetes. All right, let's get into it. It really all comes down to this one question, right? Who needs to get tested and why? There's a really clear science-backed logic behind it all, and by the end of this explainer, you're going to understand that logic inside and out. Okay, so first things first. Before we can even talk about screening people, we've got to understand the diagnosis blueprint. How do doctors officially, without a doubt, confirm that someone has diabetes? It's a super precise process, and it always starts with looking for one specific thing. And that one thing is hyperglycemia. It's a bit of a mouthful, but it's really just the medical term for high blood sugar. Every single diabetes diagnosis, doesn't matter what type, starts by spotting this. It's the foundational clue, the big red flag that tells doctors, hey, we need to look closer here. So, how do they spot it? Well, they've got a toolkit with 4 main tests. The A1C gives them the long-term view, kind of like an average over the last couple of months. Then there's the fasting plasma glucose, or FPG, which is more of a snapshot of your blood sugar first thing in the morning. The OGT is like a stress test. It sees how your body reacts to sugar. And finally, a random test can be used if someone is already showing obvious symptoms. Each one gives a different piece of the puzzle. The whole process is really logical and straightforward. Step 1, you get an initial test. Step 2, the doctor looks at the results. Is there clear-cut, undeniable proof of high blood sugar? If the answer is yes, then a diagnosis can be made, but, and this is super important, if there's any doubt at all, if the numbers are borderline, the guidelines are strict. You have to get a second test to confirm. No guesswork allowed. It's all about being 100% certain. Okay, so now we get how a diagnosis works. Let's shift gears and talk about screening, which is all about looking for the disease before any symptoms show up. The rulebook actually lays out 2 completely different screening paths. Path number 1 is a very specialized hunt for type 1 diabetes. Now, here's what's fascinating. For type 1, the first clue they look for isn't blood sugar. It's something called autoantibodies. The best way to think of these as evidence. They're proof that the body's own immune system is making a mistake in attacking the cells that make insulin. Finding these is like finding a fingerprint at a crime scene. It points directly to the real culprit. So doctors look for a specific panel of 4 of these autoantibodies. You've got ones against insulin, GAD, IA2, and ZNT8. Now, finding just one of these is a bit of a warning sign, but the guidelines are very clear. If a person has 2 or more of these confirmed, that's when the alarm bells really go off. It signals a very high risk that they will eventually develop type 1 diabetes. All right, let's pivot and talk about screening path number 2. Now, this one is completely different. If the first path was a targeted search, this one is about casting a huge, wide net. It's designed to catch prediabetes and type 2 diabetes in the general population as early as humanly possible. And right here, you can really see the 2 strategies side by side. For type 1, it's that targeted hunt, looking for those autoantibody fingerprints and people who probably already have a family connection to the disease. But for type 2, it's broad. It's about checking just about everyone's blood glucose based on simple things like age and other risk factors. 2 totally different conditions require 2 totally different game plans. So what is the first big rule for this broader type 2 screening? It all comes down to one number, 35. That's the new magic number. The 2025 guidelines now say that every single adult should be considered for screening starting at age 35. It doesn't matter if you have any other risk factors or not, 35 is the new universal starting line. But of course, there's also a priority lane. The guidelines make it really clear that testing should happen even earlier for any adult who is overweight or obese and has at least one other risk factor. We're talking about things like having a family history of diabetes or high blood pressure. In that case, you don't wait for 35, you get on the fast track. So what happens if you get screened and everything comes back normal? Great news, but what's next? Well, the rulebook has an answer for that too. The official recommendation is to get screened again every 3 years. Think of it like a regular check-in. Of course, if your health or risk factors change, you might need to get checked sooner. Okay, moving on. Let's talk about another major trigger for screening. And this is one that a lot of people just don't know about. It goes way beyond age and weight. We're talking about some pretty common medications. Yeah, the guidelines specifically name 5 classes of drugs that are known to increase your risk for diabetes. This list includes things like glucocorticoids, prednisone is a common one, statins for cholesterol, certain diuretics, medications for HIV, and some antipsychotics. So the bottom line here is simple. If you're taking any of these, screening for diabetes should absolutely be part of the conversation with your doctor. So what happens when a screening test comes back? In that gray area, you know, not quite normal, but not high enough to be diagnosed with diabetes. This is an incredibly common result, and it's called prediabetes. And you better believe the guidelines have a specific protocol for exactly what to do next. As soon as prediabetes is identified, the clock really starts. The official recommendation is to monitor for any progression to type 2 diabetes with follow-up testing at least once a year. This annual check-in is just so crucial because it's the best way to catch any changes early and give you a chance to make lifestyle changes that can make a real difference. So, after going through the entire 2025 rulebook, we end with a question that really brings it all back home. Based on everything we've talked about, that new screening age of 35, the different risk factors, the medications we just listed, are you or is someone you care about maybe due for a screening? It's a powerful question, and it's definitely worth thinking about.